And I'd like now to introduce Dr. Yana Sinai Gavrilov from the Hebrew University of Jerusalem. She will talk about changes in parent-child positive affect before and after receiving ESDM intervention. Thank you.
Thank you, Lydia. Hi, I am Dr. Yana Sinai. I'm currently from the Hebrew University in Jerusalem, but my talk will be about a part of my PhD research. It was conducted in Bar-Ilan University under the supervision of Professor Ofer Golan and with the collaboration of Dr. Tali Gev, Dr. Yonit Gordon, Dr. Giacomo Vivanti from Drexel University, and Dr. Arik Moore from the Center for Treatment and Research of Autism. And this study explored the effectiveness of community-delivered preschool-based early intervention for children with autism, and specifically the Early Start Denver model, the ESDM. So this research was conducted in a partnership with the Center of Autism Research and Treatment that gave us the access to its preschool settings and the professional training to its interventionists. The current part of the research, as Lydia said, focused on changes demonstrated in parent-child shared positive affect after participating in the preschool-based ESDM. So we know that shared positive affect is a pivotal element in dyadic interactions, mainly in parent-child interactions. This is a core social communicational ability which is related to various developmental outcomes such as self-control ability and social skills, and that is to name a few. And we know, however, that parent-child dyads where the child is diagnosed with ASD show more emotional mismatch, specifically with positive affect, and basically show lesser shared positive affect like smiling or laughing compared to dyads that have children with typical social communication. And shared positive affect is also a central component in naturalistic behavioral developmental intervention that gets a lot of attention right now, and that integrates developmental, behavioral, and relationship-based principles. And the Early Start Denver model is one such intervention in DBI with a good empirical base. It is designated for young children, toddlers, and preschoolers 1 to 5 years old. It was previously shown to have encouraging effects on children's developmental outcomes, including in our Israeli sample of children from ASD specialized preschools. A key component of the ESDM is the special stress put on the shared positive affect between children and their social partners, and that is considered to amplify, in turn, the rewarding value of social interaction. So another important principle of the ESDM is seeing parents as main agents of change in the child's treatment process. So parents are encouraged to actively participate in rich positive interactions with their child and are usually, more often than not, trained to implement the principles in their daily activities with their child, like bath time and meals. And in the last 7 years, the ESDM has been undergoing a process of dissemination in Israeli community ASD preschools, the ACR ones, now reaching a growing number of children and their parents. So in Israel, most children who receive the ESDM also take part in parent-child joint sessions in which the parent is trained to implement the treatment principles. It happens usually in the preschool setting, and now with COVID, it can also be provided online by the preschool therapist. So in this study, we assessed changes made in parent-child shared positive affect among children with ASD and their parent after participating in a preschool-based ESDM program with regular and active parental involvement. We hypothesized that children and parents from the PB-ESDM group, which is the preschool-based ESDM group, will show a greater increase in shared positive affect as compared to the treatment as usual dyads. So in this sample, we had 53 children participating from 8 preschools. 4 were from the PB-ESDM preschool settings, and 4 implemented the treatment as usual. That was 30 kids. From the PB-ESDM group, 7 girls and their parents, and 23 receiving treatment as usual, and they had 2 girls, no differences there. All children were assessed with the ADOS to verify their diagnosis and ensure they meet the cutoff, which they did. And this was not a randomized study since it was community-based, but the groups were comparable on age and DQ and family SES. But in the current sample, the groups were not comparable on adaptive skills. So the children from the PB-ESDM group had higher initial adaptive skills as measured by the Vineland adaptive behavior skills. So we chose to enter it as a factor into the analysis. In terms of the interventions, so both groups received the same number of educational therapeutic intervention hours. In the PBSDM group, 3 of those hours were delivered by therapists undergoing the ESDM specific training, adhering to fidelity and all. 2 hours were one-on-one pull-out sessions, and 1 was a parent-child session. And the treatment as usual preschools, they deliver a combination of interventions such as the TEACH, the floor time, the ABA. And in these preschools, parents receive bi-weekly counseling with the child's case manager, where they discuss different issues regarding the child, such as objectives, progress, and, and such. So parent and child positive affect was quantified using microanalytic coding with the Notice Observer software. And this is a moment-to-moment coding scheme where changes can be measured in very brief time intervals, thus providing very sensitive measures of behavior and behavior change. And parents were asked to play with their child as they usually do, with or without objects per their choice. And we define shared positive affect as the co-occurrence of positive affect in the parent and the child, such as smiling, laughing. And as I said, parents were also interviewed with the violent adaptive behavior scales to determine adaptive functioning, and that was part of the larger scheme of measures that we took for the main study. And these are the results of the analysis. It was a 3-factor design, with time being the repeated measure and group and adaptive skills being the between subject measure. And we define children as being high or low on adaptive skills using the median composite score, which was 71, and that is pretty low. And we found that children from the PBSDM group who had lower initial adaptive behavior scores made a significant increase in shared positive affect, while children who received the PBSDM and had higher adaptive scores, or children from the treatment as usual group, did not. And this set of results seems kind of surprising, since it deviates from the more common rich getting richer kind of story that a lot of the intervention research shows with autistic children, and we know. And we thought that this pattern might be related to the fact that parents of children with lower skills or lower initial skills might have received greater encouragement by therapists to set up enjoyable shared activities together and emphasize shared enjoyment in the coaching process, because that was probably, clinically speaking, the main difficulty there. So these parents might have learned to choose better suited activities for their child and to follow their child's lead, and that resulted in more positive and effectively rich interactions. And parents of children from the high adaptive skill group did not have to put as much effort in these elements, since their children more readily took part in various play activities. And our findings also highlight microanalytic behavioral examination as a more sensitive and fine-grained measure of change. And that is especially important in the case of these children with lower pre-intervention developmental or adaptive skills. And we know that in many cases, they do not show dramatic progress with intervention in standardized measures, such as the Mullen. This is the group that is also called slow or low treatment responders. And this current data set shows that they do make progress, but current standardized measures just might not be sensitive enough to capture that progress. And these changes might have also been like the first phase in their developmental progress process, so that their ability to take part in a pleasurable dyadic interaction might have opened a window or maybe set the scene for extending learning opportunities in other developmental areas. And that is supported by research from other NDBIs, such as the social ABCs, and we think should be the focus of future studies. And importantly, this set of results is encouraging in and of itself, because it is safe to hypothesize that the ability to take part in pleasurable activities is highly important for familial well-being and positive atmosphere. And that can be tempered, as we know, by the diagnosis and the child's objective difficulties. And future research should also look into into those treatment effects. So in terms of limitations, and first and foremost, this was a controlled but not a randomized study. So it does somewhat limit our ability to draw stronger conclusions regarding causality. And obviously the sample size was also modest. And importantly, this is a preliminary set of results, but it seems to be closely connected to the whole idea of a parent-child synchrony. The whole temporal characteristics of parent-child affective engagement before and after receiving intervention. And we feel like it broadens a lot of the possibilities for these children and their families. And I want to thank all families participating, and thank you for listening.
Thank you so much, Yana, for that wonderful, fascinating, and important talk.